Hi, I'm Sue Sethna. I'm a therapist and the Associate Clinical Director at Hamm Clinic, and I'm here to talk about grief. I'm really glad we have a National Grief Awareness Day because this is such an important topic. Grief is a really important and profound experience, and whether we've lost a loved person, which is what we think about most often when we think about grief, or divorce, estrangement, other kinds of losses, a person can feel sorrow, sadness, tearfulness that we think about related to grief. You might also be feeling anger or lots of other emotions. Grief takes energy, it's often really exhausting. And it's a generalization, but I think in US culture, we often have a lot of discomfort with grief. Sometimes right after a loss, in the best circumstances, people might get quite a bit of support, but that support typically wanes pretty quickly, and grief usually doesn't. There's a lot of pressure sometimes for a person who's grieving to feel like they're supposed to move through their grief really quickly. You can have the feeling that people think you should be over it. There's the sense that there's some one best way to grieve, and that's just not true. Everybody grieves differently at their own pace. It's their own process. And that is really a process to be honored. Grief can tend to come in waves. It can feel like it recedes, but then it comes back in a way that can feel really hard, but is a natural part of a grieving process. That the kinds of beliefs and discomfort and pressure I think that people can feel about grief are really not helpful. It can be very helpful to be with a person who really understands grief and can really be with you as you go through a grief process. If you or someone you know is grieving and you feel like it would be helpful to have a therapist with you in that journey, you certainly can reach out to Hamm Clinic